Today we are going to talk about dementia. So dementia is basically a kind of brain disorder where there is progressive degeneration of brain cells leading to memory loss and other kinds of brain dysfunction like losing of ways, not recognizing people's faces, forgetting things, not able to do their daily work. So when you talk about symptoms of dementia, dementia is commonly known as a disorder of memory loss, but memory is not the only domain which is affected in dementia. So when you look at it, lot of behavioral changes like excessive anger or excessive talking, reduced talking, being reserved, being depressed, having shivering of hands and feet, unable to recognize faces, unable to recall names, forgetting to eat meals, forgetting to where have they kept things. These are all part of dementia. Apart from this, some executive functions like loss of judgment, poor judgment, easily getting frustrated or unable to do their daily routine like taking bath, wearing clothes, their daily puja work, daily cooking, all these are symptoms of dementia. So a patient of dementia who comes to the hospital, the most important is history and examination, where a neurologist will take a very detailed history of their daily lifestyle previous to the symptom onset and now, and compare what all domains of their life have deteriorated. Like a patient, how he used to work before, how he is working now, how a woman was cooking before and how is she able to cook now. So in this way we get into an insight about the patient's brain function and how he is functioning in his normal life. After this, to confirm, we do certain tests like MRI brain, which shows which part of the brain is shrinking, and when that correlates with the type of symptoms, we can make a diagnosis of dementia. Apart from MRI, we also have certain advanced technologies like PET scan, in which we see which part of the brain is hypofunctioning or hyperfunctioning, and that also helps us in making a diagnosis of dementia. So when you talk about what are the causes of dementia, so apart from this degeneration of brain cells which causes dementia, there are fortunately some other causes which can be reversible. For example, deficiency of vitamin B12 can cause dementia, some infection in the brain, some tumor in the brain. So when it comes to treatment of dementia, usually we have heard that dementia cannot be treated. That is not true. A lot of dementias are caused by reversible and secondary causes like vitamin deficiencies, tumors and infections, which can be easily treated and the dementia can be reversed, especially if the patient is brought to the hospital at early stage. Apart from that, the degenerative type of dementia, which is basically called Alzheimer's disease, is difficult to treat, but definitely with newer medications, the lifestyle of the patient can be improved, the memory power of the patient can be improved.